Yes, hello, greetings everyone. We're going to share about the ocular features of Down syndrome. If you asked a question, what are the ocular features of Down syndrome? Basically, the ocular signs of Down syndrome can be classified into anterior segment of the eye and also posterior segment of the eye. But basically, to answer this, you need to also talk a little about the inheritance pattern of Down syndrome. There are three inheritance patterns of Down syndrome. There is the non-disjunction, which contributes 95% of the inheritance of Down syndrome, and then translocation and also mosaic pattern. Translocation contributes about 4%, and then the mosaic pattern contributes like 1%. That's what is essential about the inheritance patterns. So basically, if you ask about just the features of Down syndrome, you have to begin with systemic features and then ocular features. If you asked about ocular features only, you can go directly to the ocular features. So I would like to start with systemic features, which are just quite a few. Basically, there is the mental retardation, there is stunted growth, there is also mongoloid phases, and congenital heart defects. Those are the main four systemic features of Down syndrome. There are others, but these four at least are the main ones. Then the ocular features, you can divide them into anterior segment, posterior segment, and others. The anterior segment features, in the lids, you're going to have blepharitis. You can also have epicanthal folds and mongoloid slants. And the other feature that you have is frequent nasolacrimal duct obstructions that might happen in these patients. And on the cornea, you have keratoconus. And in the iris, you have Bruchfeld spots or iris atrophy. And they also tend to have some cataracts, and specifically they are basically punctate subcapsular cataracts in these Down syndrome patients. The posterior segment, there is increased retinal blood vessels across the optic disc. Then the other ocular features that you could have, which could be there or could not be there, so they're not always there. There's high myopia, there's also strabismus, nystagmus, and amblyopia. You could also find them with macular hypoplasia. Thank you very much. This is what we had about the ocular features of Down syndrome.